Thank you. Welcome back. Long time no see. Looks like, Lee and I are having way too much fun out here, and we're back here. Yeah. Right, Lee?
Well, I picked a different chair, and I was going to wear a hat or something maybe, but yeah.
Yeah, so in case you missed the last session, my name is Abhi Kalra. I'm the Executive Vice President for Canada Health Infoway. But in all seriousness, this topic, the public-private sector collaboration and partnership, is extremely near and dear to me, which is why I'm honored to get our guests on the stage and really talk about some of the work that is really happening on the ground. Not purely from a buyer-supplier standpoint, but truly, the public-private sector folks coming together and discussing, problems and then how to actually solve those, and then develop meaningful solutions which are relevant for this thing. And this is why, I'm pretty excited to actually host this this particular panel session. This session took shape a couple of months back when we invited our industry table collaborative, which is consisting of about 35 members, private sector members, from the Canadian and the international companies. And we offered them to submit proposals of something which is relevant, something on the ground, which is in play, something which is up and running, and something that supports both the jurisdictions, the solutions, the private sector solutions, but also tie into our collective connected care roadmap. And we received an overwhelming response, to those proposals. And I can tell you there were some really high quality submissions. But as you can imagine, we with the constraints that we have, so we selected two very important initiatives, both of them coming from Maritimes, which are very important in terms of solving the issues and the problems that you hear in the primary care space. We talk about things like, how do you get the critical information out of the primary care systems? How do you improve the quality of the data from the primary care systems? How do you use that information to put into the hands of the citizens? Because that holds 80% of the critical data in the health system. So I'm very excited to share the work that they all have done, and we'll have a Q&A towards the end. So let me introduce our distinguished panelists. Representing Nova Scotia, from Nova Scotia, Scott McKenna, Nova Scotia Health Authority CIO, and we have Ratcho Batchvarov from TELUS Health, Vice President for the Provider Solutions. They're going to talk about the success story in Nova Scotia. And then from New Brunswick, we have Burry back again. Very important initiative about patient mediation and primary care. He is Assistant Deputy Minister, New Brunswick Department of Health, and Mark McAllister, VeriSource CEO. So before we go into the panel discussions, I would invite both New Brunswick and Nova Scotia leaders to give us a view into what is the primary care problem that they actually solved and how they're actually advancing it. So let's get an overview on the ground story of how they have actually solved this problem. And then we'll get into the Q&A mode. So let's start with Lee, first with you.
Yeah, thanks, Abhi. So I was sharing some similar information a number of weeks back, and the example I was using when the slide came up was it's getting close to the holidays, and I don't know if anyone in the crowd here remembers the Wish Book, but it was certainly one of my favorite books growing up from Sears. And in the Wish Book, there'd be certain sections that I would always check out as a kid. I'd be looking at the hockey cards, I'd be looking at the video games, maybe some of the cool toys that year. But then there was always this section with like pajamas and luggage from like pages 42 to 50. I could care less about. It's not my thing. But I'm sure some people were looking for the luggage, and the luggage was an important part of what made the Wish Book what it was. And I say that because, when we look at a lot of the problems and the challenges we're trying to solve, we've got a new government in place, as I mentioned, in New Brunswick. We're often looking for those shiny solutions, those hockey cards, those newest toys. But there's other pieces that are really, really critical as well. And so when we look at a lot of the elements that we focused on, on My Health MB, getting a lot of those initial pieces right are key. And I really just wanted to start there and frame that, because someone who just came to health 2 to 3 years ago, if there's someone else like that in the room thinking, hey, we're just going to go home and we're going to implement this tomorrow, always think about the luggage. and how critical maybe that is in the context of the grand scheme of things. There's really key under the hood elements that are really important for us to get right around registry, integration engine, our repositories, you name it. And then and only then, when we get those things right, does it make our lives easier for a lot of the other pieces. So it really, for us, it started back, we're really looking 15 years now. And then looking at the concept of My Labs NB in 2018 through 2019, early work that we did with Canada Health Infoway around the Access Atlantic work, which is a huge catalyst for us to be able to get us ready to move forward. And put that investment in place, which New Brunswick really appreciates, and sometimes maybe those things, again, can kind of fall off to the side. But the story and the path with our wonderful partner in Verisource really picked up around the time of COVID in 2019 and 2020, when, as all jurisdictions were, looking at how do we respond to some of the needs that are being placed upon us in New Brunswick, and how can we leverage the information in our systems and hopefully unlock it to better enable response to some of our pressing demands at the time, be it through the actual credential, be it through test results, you name it. And so we'll talk a little bit later today about how that has worked and the important steps that we've taken. But the beauty about that launching off point with Verisource, with MyHealthMB at that point in time, is that we've been able to take it from that initial piece during COVID-19 and expand it significantly. And Mark will do this much better justice than I will, but when we talk about Gateway as a service, that FHIR repository, we have so many different systems in New Brunswick that collect little pieces of information, different formats, different flavors, but they're all important parts of the equation. And what we've been able to do with Verisource has been able to leverage their insights and expertise and technology to pull all of that together for us in a very seamless way that, as you'll see in a moment, we've been able to take that experience and bring it to New Brunswickers. And it's been such a valuable and important part of where we've been. So over the last number of years, we've scaled, kind of shifting from COVID-19 test results and immunizations into bringing a number of other important pieces to New Brunswickers. And in 2022 and 2023, that really focused on putting some of those key results in their hands, be it through immunizations, medications, labs, and diagnostic imaging. And originally, that was all done through a portal, which a lot of people still use today. And that's a really important part of it. But also earlier this year, we launched the MyHealthMB app. And taking that one step further, we launched the patient summary earlier this year. And we'll speak to some of those in a moment. So when you look at MyHealthMB, we really see that as our digital front door. It's a place that we've slowly and steadily built upon, that someone can take it, and even without logging in through their secure environment, they have access to a lot of information at their fingertips. Now, as we've built on some of those pieces, we have labs, immunizations, medication, and results. And you'll see the share patient summary that we'll talk about in a little bit. But the other thing, we talk about health literacy. Verisource has done an excellent job in working with our team internally to really make sure that that experience is as positive as possible. And for every subsequent release we have coming out with MyHealthMB, yes, it's about adding new functionality, but it's also about making that ease of use and experience even better. So this is the patient-mediated patient summary. And so if you see on the far left-hand side, just at the very top of your screen, we had labs, immunizations, medications, and imaging reports. And then you'll see a green bar that exists there now, which says show result summary. And so when an individual clicks on that, it will bring up a long privacy notice and disclaimer list that was very well thought out, and we needed to make sure we got right, Mark? And then from there, what will happen is it'll prompt the user to select the language and to select a PIN. So do they want it shared in English? Do they want it shared in French? And then also the PIN, accompanied with the QR code that we'll talk about in a moment, sets up that two-factor type authentication that's really important when sharing that in a very secure way. So if you have a phone with you now, which some of us may, if you want to take your phone, open up your camera app, scan the QR code on the screen in front of you, and then if you put in the PIN 123456, hit submit. And just like that, you'll be given a subsequent screen that allows you to access Mr. Homer Thompson's information. So that's really the ease of use and how it works. What will happen is you have that on your phone goes wherever you do. And if you're in a different province, a different locale outside of your home community, you've got that information that you can share with the provider. It has medication summary, immunizations, lab results, and imaging reports, and you can dive into those details. So instead of Lee Burry getting into a skiing accident in Alberta, and then when I end up in the hospital and they ask me what my medication looks like, and I have these large blue pills that I take, I think it starts with an X, I'm not sure. Now I can give the clinician the information that they need and they have it at their fingertips. So we really love the concept and thought of putting, this in the hands of patients. The one other thing I'll maybe share here very briefly, also does not have a primary care provider, and sometimes that gives me street cred back at the Department of Health when you can lead by example in that regard. But in all sincerity, about a year and a half ago, I was going through a medical situation where going from one provider to another trying to explain my situation, ultimately I needed to see a specialist. I mean, that's what I thought, and turns out that that was the case, but I'm not the person that decides that on my own. I had the same test given to me or assigned to me 3 times because nobody, even though I already had the test done twice, the other providers couldn't see that in the system. So at least now I can share that with them. They can see the test has already been done. They can see the results, and I can be on my way in the journey. So it's a waste of time for me, for the provider, and ultimately a draw on unnecessary resources in the system. But we didn't have that record. So as we look to bridge, not a silver bullet, but that's a way to actually move that piece forward. So, what New Brunswickers are saying, top left, I'm sure that'll lead to people misdiagnosing themselves. And we do have the positive and the negative comments. But I think what's important as we start is that we're open and prepared to that. When we hear perspectives about, I think it's a safe way to share your information with the healthcare professional. I can see the advantage of having the meds list because when you go for tests, we often ask what that is. And then I'll just pick on one other comment on the right-hand side. 30 years ago, I was in Ontario for a visit with some friends, and I was pregnant at the time, and I had a miscarriage. So maybe if the doctor had access to my information, that could have been helpful. So we see really good feedback, and we need to take it all, the good, the bad, and the ugly from the patients and the providers. We're very early days in New Brunswick, but it's a really great success story with VeriSource that we've been able to make happen. Again, we'll probably get into this a little bit in the conversation, but just suffice to say that think about all the different repositories we have today. It's VeriSource's gateway and FHIR repository that really allows us to pull from all those systems so that when the request is made from MyHealthMB through the digital front door, we leverage VeriSource, they pull that all through, and ultimately we get the summary viewer on the other side for both clinicians and caregivers. Good?
Great. That was great. I think this is a very important and innovative solution, specifically targeted at the patients. And I'm sure other partner jurisdictions are making note of this and they're getting some ideas from this. And the beauty of this is, this could actually serve as a good template, because you have a design, a conceptual architecture or solution available. So other partners, could take advantage of. Thank you, Lee. Over to you, Scott, to talk about another important initiative, that you're actually leading in Nova Scotia.
Well, thanks so, excuse me, thanks so much. We can probably go to the next slide. I'm on the clock, and I feel like we're in a baseball stadium here with the big lights. So if I could talk this story for 2 hours if we wanted to, I think I had 5 to 7 minutes. This is the most important slide you're ever going to see. I came to Nova Scotia 2 years ago to drive some digital transformation. We had a government that was elected on health only, transforming health. And it's massive, and we do more faster. First thing we did on digital strategy was put in here. And what are the lenses we want to look through in everything we're doing? Since then, come back to this and hold me accountable if we're not doing this. The Nova Scotian is the most important, front and center in everything we do, and we've heard that consistently all morning, as it should be. Nova Scotians want to make sure that whoever their provider is, they have the information so they can make great decisions. They want to make sure in a digital world that their information is secure. I actually have a low trust of government myself, so that even makes us more front and center on what we need to do. Make sure governments trust because it's fundamental in what we do. Nova Scotians and patients want convenience, and they should. The financial industry has done this to every one of us. They set the expectation of information anytime, anywhere, any place, And let me challenge every one of you, you should not accept anything less than that in health. Because health is behind, we should demand better. And we can get there. And we want to make sure that we can actually bring, I think Ontario was talking about that earlier, bringing services to people and help equity. You know what? The same service do not exist across anywhere in the province, and we need to do our best to actually make sure we're bringing services across the province to Nova Scotians. We look at the clinician experience. They want the same thing. They spend too much time looking for information. You know, they're trained to make incredible decisions and provide incredible care. And they have, 25 to 10% of sometimes the information. So they want to make sure they're not having to search for it. We're saving their time. They want to spend more time with patients and focus on the patient. So making sure that we're focused on that. And the third stream there is really about the administrator in the system. You know, the administrators want good data so we can understand where they want to make investments. Where do we have to put more health human resources? Where do we actually have to put services across the province? How do we reduce risk? Data is the driver behind all of that. If you go to the next slide. Really quickly, this is a snapshot. It could be from any area. You know, acute care, we probably got 600 systems in the province. Primary care looks kind of good, except they're all individually set up with the same technology, but they're individual systems. You know what? It's a free-for-all. It's a spider's web, and it doesn't work, and we all have that experience. So what did we do in the next slide? In 2023, this is how quick we're going, folks. In 2023, I took this slide to our leadership teams, the two CEOs and the clerk and the deputy, and this we improved. We had to land on standards. You can see we went with Fire 4 as the standard in Nova Scotia, and I did not want any technology in Nova Scotia that doesn't work with that. I'm tired of plugging and playing. We want to plug and play, and so it works. Now, we can't stop the clock and change things in the system. It's building the plane while it flies. You can see we're now changing this. We have all of our systems at the bottom, acute care, primary care, virtual care, community prescriptions. We're connecting and flowing information through APIs to that, what I'm going to call the comprehensive electronic health repository. It's your electronic health record for a Nova Scotian. It does not exist in any EMR. Pieces of the pie exist in various EMRs. So we're building it together to come across there. When we have that data built on standards, you can see on the right, boom, then we can actually do real analytics and research. And we can leverage AI on top of that to real outcomes, because AI fails globally because of data, both internally and externally. I want universities to come in and do research. I want private companies to come in and do research on health data, to prove health outcomes. You know, research is care. So that's what we're doing in Nova Scotia. And up top, if we have your data, we can sure as heck give it to the Nova Scotian. So we've done that through our platform that we called Your Health Nova Scotia. Next slide, please. It takes us on the primary care piece with TELUS, a great partner we're working with. We have two primary care EMRs. TELUS is MedAccess and Acuro's, QHR is Acuro. Like I said, I thought that was a good news story. They might as well be 1,000 EMRs because they've been set up in individual clinics, no data standards applied to them, and everyone and all configured differently. That's okay. That's a reason not to do anything. We're here to fix it and transform. So what we've done here, we want to look at this, and we've heard pieces of it, but this is how fast we're moving. The key piece out of this one, we have a standard, Fire 4. I said that the U.S. actually declared on the course after us. But what we're doing here is leadership and alignment from the top. Right from the top, our minister and our premier. In spring 2024, they passed legislation in Nova Scotia. So all providers in Nova Scotia must provide their health record. It wasn't optional. It wasn't consulted. It wasn't the typical way we do things in health. And it took a lot of political capital. But we did that. And that was spring 2024. The regulations around that, I must say, the College of Medicine, wasn't 100% on board. Until we worked through the regulations, and they're 100% on board. We met with the health committee in September, and the questions to, we were telling our story, but the question to the college, 100% with them on there. We implement it the right way. So you can do this if you have the commitment, right? And that's what the key piece was here on trying to get primary healthcare data, or we wouldn't be able to deliver and do more faster. Next slide, please. Think about what we've done in there working with TELUS. We started the conversation with my colleagues over here and a colleague beside me, even at 4 months prior to legislation. So we got to make this happen, folks. Work with me. You're such a big part of our primary care issue. So we have 4 months to initial solution. After that, 3 more months, we had 60% of data. We're almost at the end. At the end of this month, we'll have all of our primary care data for every Nova Scotian within our TELUS environments. And for context, even in the last 6 weeks, we've onboarded 5.5 million patient charts, which translates to about 800,000 individual unique patients. Because, of course, Nova Scotians go to multiple primary care providers. In Nova Scotia, we have pharmacy walk-in clinics as we expanded the scope of pharmacists in Nova Scotia. So we're bringing it all together. So we've done that. We have our pipelines and the text pieces to bring that data together and align it so we can get to that unique record. We're bringing across our hospital systems as well. And in 12 months from that first 4 months, there'll be in a couple months now, we'll have real-time using Fire API, which is what the whole goal course we want to get to. We're doing it now where it's actually done daily, automated, but it's not through the Fire API we want to get to. We're working with our partners on that. Next slide, please. Look at NeuroHealth Nova Scotia. This is our citizen-facing application. It's about a year now. It actually was November 1st last year we launched this. And we intentionally launched it with no health records. The objective here in Nova Scotia wasn't to focus on healthcare and health records. You know what? I'm a pretty informed individual, and I pretty well know if I eat better and I exercise, I'm probably have better health outcomes. Doesn't change my behaviors. Right? So if we can pontificate and tell people what they need to do, or we can figure out how to change behaviors. So we went to change management. We launched this. This is a tool to empower Nova Scotians. Nova Scotians can come in here and find out where they can get access to care. You know, one of my emergency doctor friends says, Scott, what's worse than sending someone to an emergency department? Sending someone to an emergency department that's closed. Pretty powerful statement, and I use that because it really resonates. So we're managing the data sets across the province, clinics, hospitals, pharmacies. Our Pharmacy Association Nova Scotia is a data steward for those sets. We're managing those data sets. They're online, real time. Something changes, they're managed. Build it once, use it many times. We went in there and then we started launching health records. You can see some of the health records, very similar to what New Brunswick does, different look and feel, of course, but medications, 10 years of medication there. Lab and DI, I think it's 2 years of historical pieces there, hospital visits, health visits, and of course immunization data. But we look at that and we go, it's not just the health records though. If the government passed legislation in Nova Scotia to expand the scope of pharmacists, they can do strep tests and deal with sore throats. But today's a TikTok world. How do you get that out? People don't know that. So we want to give that. We have that direction here. People can go and ask those questions, and then get directed. Here's your options for care. Virtual care. We've expanded to every Nova Scotian has access to virtual care. Right? Those with a primary care physician and those without. You can find out through the apps. It's not just about your health records, it's that full comprehensive health management tool. That's what we pushed here. And you see some of the quotes from citizens. When we look at can you go back one slide real quick, Abhi? Patient summary talked about a lot. This isn't everything, of course. These are just some of the pieces we'd see in a patient summary. But we'll have a comprehensive patient summary based on the International Patient Standard for every Nova Scotian and every provider, Q1 of next fiscal year. And I'll hit that target because I think we're going to exceed that. It'll get better, sure, but it's really, because that is the game changer to start. And we'll actually provide the full comprehensive medical records as well. People can access different ways, but that is the game changer to be what Lee talked about, to take across the country or wherever you need to take it. And of course, we went with the international patient summary, no different than the Canadian one, except we wanted required versus recommended. We want to make sure it's there. The key takeaways, you can look at that. I talked about leadership. I talked about right from the top with our premier, driving through legislation. Down working with, we're driving across, my teams are working across all the various entities to make this. We're very much aligned. Centralized government accountability. I think if I was going to, number 4, so critical, like the citizen-centric approach in everything we're doing, which isn't always aligned with physician approach. We get that. This is change management. And I'll give a quick story as I wrap up on that, because we talked about it. Like, putting the power and the information in the hands of an individual, it can be life-changing. We had a recent incident where a Nova Scotian reached out. Of course they can. They said, this isn't my data, this isn't my medication. Okay, well, we have teams, we have a way to track that. We trace that all the way back to our source system, a drug information system. And actually, she was right. I shouldn't have said she, from a privacy standpoint, but she was right. What happened is the pharmacy actually had linked two individuals together at the pharmacy level. So we actually discovered that when the individual actually brought that back to us. But you know what? Because that was linked, that information is being trusted by hospitals, by doctors today. And it was actually inaccurate. Now, in those cases, it wasn't an adverse drug, probably wasn't life-threatening, it was, but it could have been. Right? It's giving people the power in their hands. So, the three things I'd leave us with would be embrace. We need to really embrace the power of information. We ask people to do that, citizen level. Citizens to be an active participant in their health. And at the end of the day, as we go to the future, this takes us in the path where we can get to the future of healthcare, personalized healthcare, proactive healthcare, and really empowering, could be empowering for everyone. Thank you very much.
Perfect. Thank you, Scott. I think the work that you're doing in Nova Scotia, and I think your passion to fix the problem and setting the bar, and then I love the tangible plan. The tangible plan, I will do this by this date. I think that shows commitment, because that's realizing the importance or the gravity of the situation, so it's great. And I think, again, we will cross-share some of these learnings and some of the successes, with other partners as well. So perhaps we can start with some Q&A. So Mark and Ratcho, let's start. When you were working, with your public partners on these initiatives, how important was it to first, align your priorities? Because, everybody have their own roadmaps. They have their roadmaps. You as private players have your own roadmap. And I think, how difficult it is from a demand perspective, because you actually operate nationally. So how important it was to actually come to that conclusion that, yes, this is the priority, or this is the initiative we want to go after?
Yeah, I'll start. Thanks, Abhi, and really enjoyed hearing from you, Scott, and Lee, as always. For us, I guess the most important part for us was our client is courageous, right? So we have a client who decided to start, and the patient-mediated patient summary, I believe, is the first in North America. So we had the opportunity to be in Atlanta at the HL7 World General Meeting, and we spoke about what we'd seen through this process, where the government of New Brunswick said, we're going to put this out there. We may not have consumers of this patient summary, but we're going to start. And for us, we had a line of people in Atlanta coming to talk to us because we had real patient bad news stories and good news stories on what this meant. We learned that people who are newcomers to Canada travel home and bring this information with them and now get better care where they are from and come back healthier. All of this stuff is new. It's new. It's kind of hard, I think, as a government sometimes to be out there. And once you get out there, how do you continue the momentum? So I think what Lee and team have done really well is stayed agile through this process. So you start and then you continue. And we work with the team weekly on making sure that what we learn gets implemented into the next phases of the project. So that's been our story in New Brunswick, and we really appreciate it.
Great. Thank you, Mark. Ratcho?
Yeah, so I can echo exactly what you said, Mark, because it was the same for us. When we started the project, it was really critical that we aligned strategically at the highest levels of the organization. And that set the tone for aligning on priorities, vision, strategy, and focused on execution and excellence. I think early on, and Scott mentioned this, aligning on the FIRE standard was actually game-changing in terms of our ability to execute and really set the foundation for long-term sustainability for the project, thus allowing greater interoperability opportunities down the road. I'll provide an example, which I think, as I was listening earlier to some of the panelists before, there was a lot of talk about sharing patient information. And one of the significant, I guess, critical challenges of alignment that we had to go through initially with Nova Scotia was aligning on consent management. And so, we had some real concerns with regards to our ability to share data at scale, given the clinics and providers that we support in Nova Scotia. And this is where, by working together with Scott and the legal teams there, they actually enacted a legislative framework which alleviated those concerns, meanwhile allowing us to safeguard our contractual relationships with our clinics and provider customers. So to echo back, I think it is extremely important to set the stage appropriately at the beginning of the project, which really was a catalyst for us to be able to deliver in record-setting time for a project like this one in Canada.
Mm-hmm. Great, fantastic. Anything else to add, Lee or Scott? I think these type of projects, where you actually have data, let's put it, health data involved, usually you run into obstacles maybe towards the end. So perhaps you can share maybe one challenge or obstacle that you faced, and how did you solve that together? It's usually, I think, when you look at a typical, buyer-supplier relationship, the supplier says, I am off the hook. Buyer, you have to solve this problem, right? But while my meter is still running in terms of billing. And I saw some good partnership, in these two engagements. So perhaps you can share one of a challenge that each one of you faced, and how did you actually together solve it?
Well, okay, maybe I'll start. I think when you're working on a project that is transformative, I think it's the first time in Canada that we were able to extract, transform, and provide primary care data at scale at a provincial level anywhere. So you're bound to run into some issues, technical challenges, of course, along the way. What really felt different to me in this collaboration and partnership is that it felt like we were one team, meaning that there was a shared kind of responsibility when issues arose. So it didn't matter if the issue was on the Telesys side, for example. Perhaps we run into some data quality issues as we're extracting data from the EMR, or with some of the programs or solutions that were approved in Nova Scotia, for example, for file transfers, where we ran into some limitations. In both these cases, the team actually came together, worked together in true partnership and collaboration, not cooperation, and we were able to very quickly find solutions to these issues. And the teams are connected on a daily basis. So that to me was a fundamental difference in how this project was approached, given the time frame that we've agreed upon to ensure proper delivery. So this continuous improvement mindset really changed the game in terms of actually making sure that there's quality data checks, standard protocols as we were executing on this program.
Great. Anybody else wants to add?
I think I think talk about many obstacles, right? But I think even on the primary healthcare data we're talking about, there's a lot of reasons why not, right? And all of us come from a place of we know what we know, we don't know what we don't know. And in some of this space that we're talking about, there's been a lot of talk for a long time, but there's also not a lot of action sometimes to the speed that all of us, I think the majority of us would all like. So there's reason not to do things. So, you have to be able to take a bit of a risk and push it out there. Some of the things we got to, investing in data infrastructure probably isn't that sexy politically. But if you're really committed to change, you need to make those investments at the data and the data infrastructure level. And the province is 100% there. We've seen it with legislation, investments in there. We bring in expertise. We've had to go out. I've got some experts working globally, around the globe, working on some of the stuff for us as well. Talking about with our partners in TELUS, we have so many different EMRs. They're same technology, but they might as well be completely different. We're trying to map it to a standard. So you build pipelines and you think you could do it once. I use financial data. It's pretty clean. You think you can do it once, you can bring it all across. Well, you do it once, it breaks for the next clinic, and it breaks for the next clinic. So perseverance to make sure you're going back and starting again at that clinic and working it through. But we're there. And at the end of this month, we'll have all of our primary healthcare data in Nova Scotia. And that's just deliberate, intentional work. Have rolling up those sleeves.
Great. Lee or Mark?
Yeah, sure. I guess for us, some of the road speed bumps we had, I guess we could call them, were we all have different stakeholder groups. So patient, clinician, decision maker, government. Along the way on the steps to go live, sometimes we don't all agree, or there may be panicky moments where we realize we've released a whole bunch of information to a lot of people, and some quick decisions, I guess, needed to be made. Or the example I'll use is we put lab results out for all New Brunswickers. Well, we probably shouldn't have people learning some things through some diagnostic reports in real time. You know, we need to have people involved. So we had, I guess, really quick meetings with Lee and his team to ensure that we could balance some of these really, I guess, complicated, sensitive issues, and the team was super responsive. So that's an example I'd use.
And if I could, just very, very briefly, to build off of Ratcho's point, early on when we looked at the patient summary, we already had a roadmap moving forward with MyHealthMB for 2, 3, 4, 5 other things over the next year. So then we threw, I would say, a little bit of a bomb into it all, and the team responded extremely well. But having that one table where we could bring VeriSource and Department of Health and other key partners as well that are critical to that, to say, here's where we're headed, is really important. And then for Mark and I to be able to have those conversations one-on-one on a very regular occasion as well, when something did go sideways, is so important.
Mm-hmm. Great. One of the things that we asked in the last panel as well, scalability. So first of all, I'm taking away that these are not customizable solutions or templates. I think these are pretty much, you know, you can just lift and apply any other jurisdiction that is willing to actually take this approach and meet this objective. So perhaps you can also reflect on how would these solutions or templates would work with some of the other players in the ecosystems. Let's say, you know, in case of VeriSource, you know, you have a number of other consumer apps, you know, within those regions. So how does your solution offer that openness from an innovation standpoint, but not locking the market and giving them the access?
Absolutely. You know, Scott mentioned FHIR standards a number of times, International Patient Summary, PSCA. There are a lot of vendors in this room who all do, you know, pieces or maybe the whole package. The parts that fit together, if we are all kind of conforming to these standards, allow smaller companies like ours, or now we're part of a bigger company, to work together in a standard, in a standards-based way. Integrating health data in New Brunswick, we're 800,000 people, is maybe easier for me because I can talk to Lee every day. But the problems that we're facing, I think, are similar to the bigger jurisdictions at a different level of scale. Obviously, cloud-based, you know, these things scale very easily in terms of technology. I think it's the people scale that needs maybe attention, where we can spend the time with each other. If we can learn something from the Maritimes, we like to chat and trust each other. So I think if the trust can scale, the technology can scale too.
Mm-hmm. Anything from your side, Ratcho?
Maybe completely agree. I think one of the key differences, again, coming back to even what Angela was saying this morning, it's policy changes. Because as you can expect, if we have to figure out a solution to scale in a big and large province, where we have to capture and manage consent at the individual level, there needs to be creative solutions for us to be able to enable that. And so again, the game changer in how quickly we were able to move from concept to pilot in Nova Scotia, for us, the technology wasn't the barrier. So cloud technology is being widely adopted. We've all kind of decided to standardize on the FHIR standards, so those things are already there. Often when things get slow is when there's policy hurdles. So there's no reason that what was done in Nova Scotia can't be scaled to other areas. And actually, we have a lot of interest in just thinking about the Infoway Pan-Canadian Interoperability roadmap. Well, one of the key pillars is allowing patients to have access to their own health information. Here's a great example of that, right? And so sharing these patient summaries, absolutely not the silver bullet, but being able to actually provide primary care data at scale is not a thing that can't exist right now. It's a reality, and it's happening, and we're going to have 100% coverage in Nova Scotia very soon, as Scott mentioned.
Mm-hmm. Fantastic. Perhaps one question for those who are prioritizing this type of initiative to unlock the data from primary care. And we heard, I think, some larger jurisdictions like Ontario, and I'm sure in BC and everything. Scott, from your perspective, and Lee, from your point of view, one piece of advice up front, while they're actually conceptualizing this, the solution or this problem solving, what should they look for? One piece of advice if you could offer.
I think, you need to have the right leadership in place and have everyone buy into the enormous task you're trying to do. This is a change management initiative. It's not a tech initiative. It's about change management because, you know, even if we look at our colleagues and tell us, if you don't come to the table with what's in it for me, we all have a what's in it for me angle. And in fairness, I apologize, you're your partner, but for TELUS, what's in it for me part of it is, you know what, they're going to help our healthcare in Nova Scotia, but they also get to commercialize a product, they build a product that they can commercialize and take it elsewhere. Absolutely. What's in it for the physician? They're going to get the information they do not have access to today. What's in it for the patient? We all should have our access to our information. It's my information, it's your information. And if someone in health has it, you should have it. So you have to, you know, how do you actually drive that change? Unless you're bringing those perspectives to the table up front and working through it, because we do have to be deliberate. You know, we could provide a lot more to the Nova Scotians today that we have, and we don't because it's change management. We're working through it with our physician community, clinician community, and the citizen himself. You know, I bet if we ask everyone on the panel, like personally, if I had a DI and an MRI and it told me I had cancer, I'd want that online immediately. Someone else may not. But when you sit with a physician, and I've been there, and someone tells you you have cancer, you don't hear anything else anyways. You shut down. And you go home and you Google. So the more we can prepare people to come back to that next conversation and be informed, and that's what we're trying to do. That's the power of the information in the hands of the individual.
Yeah, Scott stole mine. So I was going to say value for the investment as well, so bang on with the change management. I'd maybe go and given that a little more tactical and say that really understand your data. When we talk about unlocking the data, understand where it's siloed, all the paths where it could go sideways or is inconsistent. We've learned a lot through that. And in fact, you know, we've still got a long way to go. We're doing great work with Patient Summary and MyHealthMB, but one of the next pieces we want to do is take some of that EMR data, bring it in to the Patient Summary. But when you want to do that and you're bringing it in from the EMR, if at the physician level it hasn't been coded properly or it's not in the right fields, that's a nightmare to get that cleaned up. So we are looking at things like AI as an example that may be able to help do some of that heavy lifting for us. So just understand some of those challenges there and be prepared to build that into your plan of attack.
Mm-hmm. Thank you. I think those were some interesting insights into one of the most difficult problems that we've been facing in the primary care. I think we know that, you know, I mean, 80% of our important patient health data is locked in the primary care. And so I think some of these problem solving is really going to help us address that problem. And these are two sample programs that we talked about today, but there are a number of such success stories. We couldn't bring them all, but I'm really thankful for your time today, all the panelists, and also your dedication, the work, you know, behind making this happen. So thank you so much for your time.